Good afternoon. My name is Charity Love, and I am the ICU educator here at Mount Sinai Medical Center. Today we're going to be doing a brief in-service on proper technique for IV insertion. First and foremost, you want to gather your supplies when you're going to be inserting an IV. Those supplies include whatever gauge needle that you're going to be using for insertion, the IV starter kit, which includes your dressing, your tourniquet, as well as your site prep, which includes the ChloroPrep, which is a chlorhexidine gluconate along with alcohol isopropyl. You want your connector tubing, and you also want a couple of 5cc flushes. Very important, you always perform hand hygiene first. After performing hand hygiene, you want to take a look at the patient's skin and their extremities and try and locate, in your opinion, what you think is going to be the best access site. Always you want to go for a larger bore vein, something that is not in the antecubital, and something that is not small or on the hand that might bother the patient, cause them a little bit of discomfort, or something that might not be an appropriate vein, meaning that it might be in a crease if they're with a lot of movement, or something that might be small or fragile, something that looks like it's rolling, that might be either a little bit more difficult to get, or once you get it, might have higher incidences of blowing that vein. So after you've determined, based on the patient's situation, which vein is most likely going to be the most optimal vein, which right here we're going to use this mannequin, and I've identified that we've got a lovely vein running right up the middle of the forearm right here. Okay, so after we've already determined that, I'm going to perform hand hygiene again. Remember, hand hygiene is very, very important. Place my gloves. Remember, gloves are always used to protect yourself from possible blood or body fluid exposure. It's always important to perform hand hygiene before you don gloves and after you remove gloves. Now, in preparation for the insertion, you want to have all your equipment and supplies ready to go, okay? What does that mean? Well, you want to have your tourniquet out. Okay. We have our tape here. The tape, you would like to prep that tape because after we are able to site this IV, we want to be able to secure it properly. The proper way to secure it is you're going to have about 2 inches of tape that you're going to split down the middle so that you have 2 smaller, thinner pieces of tape. I always say you just like to attach them real lightly against the bedside. Okay. We know this table has already been previously cleaned. Okay. Very important, this is going to be your dressing. You're going to see that it is a tegaderm. Part of the dressing on the top here is a soft piece of tape that we're going to be labeling this IV insertion with, okay? So make sure that that's readily available. You have your gauze. And as well, we have our specialized antiseptic. This is the chlorhexidine gluconate prep with the alcohol in it. Now, that is our secondary prep. The primary prep, we use the regular alcohol prep pad, okay? So, the tubing that we're going to be using to connect, you want to open this tubing, okay? Remember, inside this bag is considered sterile, okay? So you want to make sure that you keep this secondary connector tubing laying inside the bag. This is now the appropriate time when we want to prime it. Remember, you always want to prime the tubing before you connect it. In order to prime it, you're going to connect it right here to the hub, and then you're going to push it through. Now, I recommend this blue cap can be difficult to remove, so remove it prior to insertion of the IV and place it inside that package so that it still remains sterile. And then that way it's there at the bedside for you. Okay? Now we're ready to begin. Okay, I'm just going to position this so we can see. First, you want to make sure that you properly apply the tourniquet. The best way to apply the tourniquet is around a bony prominence. That's going to give you a little bit better of an occlusion to that vein, which would help in making it pop out a little more. Remember, it's important to make sure that it is tight, because the tighter it is, the more likely you're going to see what you need to see, okay? Always talk to your patient. Make sure you explain everything to your patient, what you're doing. Walk them through the process. They'll feel that you're a little bit more capable and that you're making them more aware of what's going on. So we've located the vein. We've already talked about it. Now first, we're going to do our primary prep, which is cleaning vigorously over that vein. We want to make sure we scrub for a good 30 seconds, okay? So we're scrubbing, we're scrubbing, we're scrubbing. Now we want it to allow to dry on its own. You never want to blow or wave anything over the top of it, okay? This is the primary prep, okay? We allow it to dry on its own, and then we're gonna open up that chlorhexidine gluconate impregnated with the isopropyl alcohol. And we're gonna do our secondary prep. Now remember, after we do this secondary prep, we are no longer to palpate this area, the insertion area, okay? Because if we do, we then recontaminate that area. So we do our secondary prep, scrubbing vigorously for 30 seconds, okay? And we allow it to air dry, okay? So we've allowed it to air dry, it's fully dry. We're going to open up the winged needle. We have chosen a 22 gauge. Remember, the larger the gauge, the smaller the needle, okay? So when you open up this needle, you want to pull off the lid, okay? Make sure the needle is fully intact, okay? Make sure it's not broken. We also want to make sure that this plastic safety guard is able to pull free and away, okay? Remember, every time we are inserting a needle for an IV insertion, bevel should be up. The bevel is the portion of the needle that is cut away, okay? So now we're ready to insert. What you want to do is you want to go distal to the site that you have chosen to insert and pull the skin taut, okay? You want to go in at about a 30-degree angle, 15 to 30 degree, right over that vein until you feel, all right, that you have flashback of blood. Once you have flashback of blood, you want to go ahead and slide that plastic portion farther up the needle head. What this is going to do is going to prevent that needle from poking through and going through that vein. So you're going to slide it with your finger all the way up into that vein. Once you've gotten all the way to the edge, you're going to retract the needle and put pressure over that vein to prevent the blood from spilling out, okay? Next, we're gonna go ahead, we're gonna release the tourniquet with your other hand and the connector that we've already primed. And we're gonna go ahead, we're going to connect it like so. Now this is very important. We wanna make sure that we can pull back and we get some blood coming back. Good, and we see that the fluid that was in the vein is coming back. And we can go ahead and make sure that it flushes freely. Beautiful, flushes freely. Okay, so we can go ahead and clamp this. Next, we want to make sure that we secure it properly. So the first tape is going to go underneath the wing, right below, and fold over onto the skin, securing the wings to the skin. The second piece of tape is going to go directly over. Beautiful, just like that. Next, we're going to make sure that we place our occlusive dressing over the top. Just just like so, and secure it. Once it's secured to the skin, we can go ahead and remove the taped portion. Remember I said that on the dressing we have that little piece of tape that's going to say initials, date, and gauge. This is how we're going to label this IV site. Okay, so we pull that off like so. Place it on the side. Make sure you label it properly with your initials, date, and the gauge right here on the side. Lastly, we want to make sure that this connector tubing is secured properly. We still have our tape that we have from the IV insertion kit. And you want to make sure that it is secured so it doesn't move around, okay, because that could cause that needle to become displaced. All right, secure it there. After you have completed this, this is how your IV should look. Secured, we have the labeling there. The labeling would have your initials, the date, and the gauge. We know this is a peripheral IV, so this IV is good for 96 hours or 4 days. After you're fully completed, make sure you clean up all your supplies, dispose of any sharps into the sharps container, remove your exam gloves, and perform hand hygiene. Thank you. Have a wonderful day.